इसको म्यूट करो. So today we'll be studying about the acupuncture treatment of disease, neurology. In neurology, we'll be taking facial paralysis. It is also called as Bell's palsy. It is one of the part of your syllabus. Now we came to a very important part. So the definition of this is called, what is called? It is a deviation of the mouth and the eyes. What is facial palsy? Is a deviation of the, it becomes like this. And your eyes remains unclosed. This is the biggest problem. So generally, if this mouth and eyes are deviation of mouth, there is incomplete closure of the eyes, and this may lead to the loss of the sight. Generally, there is a surgical operation done. They shorten the eyelid, and then they save the eyesight. So it occurs suddenly and usually only one side of the face. Facial paralysis is a peripheral facial palsy in Western medicine. It is a peripheral facial palsy. When defensive cue is insufficient due to overexertion. So it is said that when I told you that whenever your healthy cue is insufficient due to overexerted work or because of the overexerting yourself, exhaustion of yourself, it becomes like this. And healthy cue is weak. External wind may invade the channels and collaterals in the face and affect the nutrition of the tendons and the resulting to facial paralysis. See, whenever there is external wind which enters the facial pores, it affects the tendon and the weakened muscles generally here, and whenever they become weak, they become tilted towards one side, and that is called facial palsy or Bell's palsy. Clinical manifestation: unilateral facial weakness, numbness and paralysis, disappearance of wrinkles, enlargement of rima oculi, exposure of the sclera, sclera means eyes, lacrimination, flattened nostril blood groove, dropping of mouth angle and deviation of the healthy side. The healthy side is like this, it is deviated like this. Pain behind the ear in the beginning of the stage, and then there is a problem of the taste deficiency, means they cannot taste all the food all the time. Wind and cold type. History of cold affecting the face, light colored tongue, thin and white color tongue coating, floating and tight pulse. So stated manifestation with fever, dry throat, red tongue, thin yellow tongue coating and floating and rapid pulse. Is a wind heat combination within there is acute onset, is a combination of wind and heat. Q blood deficiency, it is vertigo, lassitude. So whenever there is energy deficiency of energy in the blood, you will find what the patient is having: vertigo, lassitude, pale complexion, pale tongue with white thin coating and 3D weak pulse. So you will see these patients have vertigo. Their face is anemic. Anemic means they will see whiteness in the face. The face is pale. Treatment: regage the regulate Q of the blood, local tendons and collaterals, promote blood circulation, dispel wind, and supplement energy and blood and nourishes the muscles and tendons. So what is your treatment protocol? Degrade the regulation of Q and blood in the local tendons. You have to improve the blood circulation, and you have to dispel the wind. You have to remove the pathogen from the body and supplement the Q and blood nourishes muscles and tendons. So you have to give those diet, those herbs which improves the blood energy and nourishes the muscles and tendons. So principal channels involve global means gallbladder, stomach, large intestines, liver, and extra points. So what are the channels involved? GB channel, stomach channel, LI channel, liver channel, and extra points. So principal point is gallbladder 14, stomach 2, stomach 4, stomach 6, LI4, LR3, and extraordinary 5, HN5. So what are the points involved? Global 14, gallbladder 14, stomach 2, stomach 4, stomach 6, liver, large intestine 4, liver 3, and extraordinary 5. So channel acupoint of the GB and stomach channel and extraordinary channel choose to degrade the regulate Q and blood of the local tendons and collaterals and promote blood circulation. So using this channel is used to promote the blood circulation in the area. LI4 and LR3, where Q of the organ originate, passes and stages choose to remove the external pathogenic factors. So principal treatment, wind and cold type, acute state, smooth and degrades the channel and collateral and cure dispel the cold. Principal acupuncture as stated. So where is wind cold type? I already told you those principal acupoints are same, only improve at Feng Qi, that is GB20. So whenever this wind cold type of stages is there, whenever you find those symptoms, you should add GB20 in additional to the principal acupuncture points. So GB20 is a very good point. It removes the external wind from the body. So whenever wind hit type of acute stage is there, I told you what should be done. Smooth and degrade the channel and color and dispel the wind and heat. Same thing. Principal acupuncture is already same. Only add what? LI 11. So when this blood
Hello, sir, no voice. Sir, no voice.
now can you hear me?
Yes, yes, sir, yes, sir.
Okay, so supplementary acupuncture point for difficulty in raising a eyebrow. Whenever you cannot raise the eyebrow, in facial palsy, the important point is BL2 and extraordinary 4. So supplementary acupuncture for the mastoid region. So whenever you need some supplementary point in the mastoid region, you should go for triple bomber 17. Supplementary acupuncture point for deviation of mandibular groove is GV26 and CV24. Supplementary acupuncture for flattened nasoblidial groove. So there are different stages of facial palsy you will find in patient. So you have to study in Google and pictures, or you have to observe that in deviation of mentolabial mentolabial groove. So for deviation of mentolabial groove, what are the symptoms you will find? You have to see. So you have to study those symptoms in the Google, and as per that face picture, you will understand, oh, this is suffering from this symptom, and principal points are same. You have to use 1 or 2 extra points. In doing this, you are able to recover a facial palsy case shortly. So you should wear a mask, or you should put some cotton in the eyes. Surgery is advised only in the later case so that the eyes are closed, and avoid exposure to cold and wind. Regular light diet and avoid raw material. Eye drop administration is required so that an infection of the eye is to be avoided. This is the biggest problem in facial palsy. You may lose the eyesight. So eye closure is required, and closing the eyelid by surgery is also important if it is required, but otherwise if you do it properly, eyelid can be closed in the same day, or within 2 or 3 days or 5 days you will get your results. So this part is over. Bye. So now we are speaking about the acupuncture bite syndrome. It's a wind syndrome. So bite syndrome means obstruction. It's characterized by obstruction of blood and energy in the channels, and collaterals caused by the invasion of pathogenic wind. I already told you, whenever there's cold and damp, the inflow of energy in the channels is stopped, and that is obstruction created. And because of this, you will have pain, numbness, heaviness, and limited movements of the muscles, tendons, and joints. And morely, you will see swelling and hot sensation in the joints. So, Bai syndrome can be seen in RA cases also, fibrosities, neuralgia in Western medicine. Generally, you find in rheumatoid arthritis and ankylosing spondylitis and various other cases, you will find Bai syndrome in the patient. So it is an invasion of external wind which leads to the obstruction. I already told you. Invasion wind obstructs the muscle, joints, and collaterals. Because of this, you suffer. It is divided into two categories. One is wandering, that is, the wind is wandering, and one is fixed, and one is painful and hit by. So they are divided into four categories. One is wandering, you see patient pain is here, sometimes here, fluttering pain. One is fixed, means you will see certain area which is a fixed pain, and one is painful by, means it's soreness in the knee or typical joints, finger joints and all. One is hit by, here you will see lot of will explain it in the coming slides. So the constitutional weakness is leading to the deficiency of the defensive cue. So whenever the energy is defensive, there is a deficiency of defensive energy, you suffer from this. Pain of the muscles and joints with limited movement. So there is a pain of the muscles and joints with the limited movements. And state manifestation with migrating pain may be febrile, aversion to wind, pale tongue with thin and white coating, and floating pulse. So this is, you see, severe pain with fixed location that is relieved by warmth and worsened by cold. No local redness and heat, light colored tongue, thin white tongue and coating with very tight pulse. These are the clinical manifestations. So severe pain with fixed location. So you will see there is a severe pain, and that is relieved by warmth and worsened by cold. So when in the RA cases, rheumatoid arthritis cases, whenever you see they have aversion to wind, they don't like wind or fan or air condition, because the moment you expose them to wind, their pain increases. Whenever there is painful by, you will not find any local redness and heat. Light colored tongue. So whenever you find, they will see that tongue has a white coating in the tongue, and it is fixed pain, and generally it is in both small and large joints. So dampness when it is fixed, soreness and pain of heavy sensation, swelling or numbness of limbs and joints, worsened by the occur of rainy days, pale tongue, whitey, sticky tongue coating, and slippery pulse. So heat and swelling and extruding pain of one or severe joints with limited movement, fever, aversion to wind, thirst, restlessness, red tongue, dry and yellow tongue coating, and rapid pulse. This is hit by syndrome. So what should be the treatment procedure? Activate the Q circulation, nourish the blood to remove the obstruction, strengthen the kidney fire to expel the cold evil, improve the function of the spleen and stomach and eliminate the dampness, expel wind and heat and relieve the swelling. So whenever you relieve the wind and heat, the swelling is removed. So what are the principal channels? Local points and the acupoints. As per the symptoms, you have to select the local point and the acupoints. Together with local and distal acupoints along with the involved channel, choose to activate Q. There is energy and blood circulation in the local area to regulate the in and vacuum in the order to remove the obstruction. So to increase the defensive energy in order to remove the obstruction caused by wind, cold, it is wind caused by wind, cold, damp and heat from the channel and collaterals. Now we come to the Now the supplementary acupoints are BL17 and SP10. See, we have to select these points as per the symptoms of the patient. See, here the points are selected as per the disease of the patient. If the wind is very high, you have to select Feng Qi and all. So in coming slides, you will understand which are the points we have to select and which are the points we need not to select. So you have to improve the, even in whenever there is a cold time, you have to improve the fire to the of the kidney. So generally the kidney is affected. The coldness is affecting the kidney. So use the kidney fire point. Very true. So how to improve the kidney fire? You have to see that will come also in the coming chapters. And supplementary acupuncture points are BL23 and CV4. Now comes a fixed pain. This is a big by syndrome which creates pain. So what is a principal points that we will discuss, and your work is to improve the same thing. Remove the obstruction and remove the function of the spleen. Here you need not to select the kidney. You have to improve the function of the spleen and stomach to eliminate the dampness. It is said that dampness is created because of the spleen and stomach. So improve their functions and you get relief from this. The principal point is SP9 and stomach 36 is a supplementary acupuncture point. So along with principal and local points, you have to select SP9 and stomach 36. Now comes the heat by syndrome. So what are the points we have to select? Same thing, expel the heat and relieve the swelling. So what are the principal points? We'll discuss. Now with the principal point, what are the points we have to use? GB14 and LI11. What are medical advices? Avoid cold and raw food, avoid protein diet, and you have to remove the patient from wind and cold and done. So whenever you see a patient having multiple joint pain, swelling in the joints, immediately protein diet has to be stopped. Because protein will increase the temperature of the body and it will create a problem in the patient's life. And it will also improve the, it will increase the pain in the patient and he will suffer from a lot of other problems. Especially we should always remember rheumatoid arthritis may lead to organ failure. And let's go to this case. So to avoid this, acupuncture plays a supplementary role. These problems cannot be cured. Principal points we have to select as per the disease and the symptoms of the patient. Whenever certain cases will come, we keep discussing. And in the coming slides, you will also find a lot of similar acupuncture points which can be acted as a principal point for the treatment of the patient. एक और है urinary retention. Here you go. This is a very difficult disease which we found in acupuncture. It is hyperactivity deficit disorder. Action, hyperactivity deficit disorder. ADHD, action deficit hyperactivity disorder, it is said. Here the child is hyperactive. It does not obey any command and it's very difficult to control this child and it becomes untreatable disease. As of now, there is no treatment of this disease in Western medicine. Most stabilizers can be given, but to maximum cases, it does not support. So here you will see there is a delayed milestone and they are concentrated with, if they are compared with normal children, they have a poor memory level, they react too much, they try to attract the attention of their parents and in most of the cases it is called as biological, psychological, social psychology factors in Western medicine. So it is caused by the prenatal weakness, deficiency of kidney essence, leading to young hyperactivity resulting to stirring of the internal vein. Generally, whenever there is a kidney essence, there is zinc. But you can see there, whenever the kidney is in energy of the kidney is down, leading to young hyperactivity. So if in is down, the young is hyperactive. In does not controls the young. In controls the young controls the in. So whenever in control is less on kidney, young hyperactivity increases and it leads to stirring of internal wind. So what will happen? Emptiness of the sea of the marrow resulting to the failure of the nourishment of the spirit. So brain is also called the sea of the marrow and then it becomes a lot of difficult to the controlling the patient. So deficiency of the spleen and heart resulting to the poor nourishment of the heart and spirit. So generally in TCM the heart is considered as the brain and because of the poor nourishment this happens. So the chief symptoms are unstable emotions, abnormal behavior, hyperactivity, poor coordination and disability to concentrate. So whenever indeficiency with hyperactivity, you will find irritability and hyperactivity, too much talkative, high sensation in the chest and soles and palms. You will find the heat sensation is there in the chest, soles and palms. Night sweat, dreaminess, dry and red tongue, thin tongue coating and steady rapid pulse. And heart and spleen deficiency, you see restlessness, poor memory, profuse dreaming. Easily they get fattened, swallowed complexion, poor appetite, loose stool, pale tongue, thin white coating, and steady slow pulse. So this is what heart and spleen deficiency type of ADHD case you'll find these symptoms. Treatment is very simple. Calm the mind, heart and spirit, replenish the brain and promote the intelligence. Nourish the yin and suppress the yang. So what are the principal channels? Governing vessel, kidney, liver, heart and extraordinary points. Principal points GB20, liver 3, kidney 3, heart 7 and extraordinary 3. GB20 and extraordinary 3 supports the and choose to calm the mind and the spirit. Through stream and Unsonar's acupuncture of the kidney and LR channel, where Q of the Vizira originates and passes and stays, and chooses to notice the yin and suppress the yang. Heart 7 is a very good Yunnan source point, and where the Q originates and passes and stays, chosen to calm the heart space. So these are the general points which we used and why we use. The reasons have been given here, which you have to study for yourself. So yin deficiency in yang hyperactivity type. So whenever you see this yin deficiency and some principal points already you have seen, notice the yin and suppress the yang is the principal treatment strategy. What are the points you have to use? Spin 6 and GB 43. So principal treatment of heart and spleen deficiency, calm the mind, heart and spirit, and replenish the brain and promote the intelligence. Tonify the heart and spleen. Extraordinary other points what you will use? BL15, BL20 and stomach 36. So whenever you will see heart and spleen deficiency of the symptoms which we have spoken back, very simple, calm the mind, heart and spirit. So in hyperactivity, your first target is to calm the mind. These are the points which you should use. BL15, BL20 and stomach 36. TCM, avoid emotion, stress, overwork and exhaustion among the children. Proper education, psychological treatment must be incorporated. So with this, we have completed 3 topics: facial palsy, ADHD, and Bay syndrome. So these are the 3 important topics of the subject today, which we have completed in the webinar. So a few more topics are left, which will complete gradually, and I hope by December end, our webinar will be completed successfully. Okay, thank you so much. Any questions? Any questions? Ahmedabad, tell me. 1 minute, we could not mute it. And now tell me.
No question, sir.
Tell me. Yes. Tell me your question.
Hello, sir. Hello, sir.
I can hear you. Tell
Raja, sir. This is Dr. Raja.
me, I can hear you.
Sir, how can we identify that the patient is suffering from Bay syndrome or, sorry, sir, heat?
The symptoms have been given. The symptom of each principle has been given very clearly. You have to see the symptoms and identify the cause of the disease.
Okay, sir.
Remember, symptom is the pathway to the cause of the disease. So the symptoms have been given. See the symptoms and you identify which category of the disease it is.
Okay.
Asan, any question?
Yeah, no questions, sir.
प्रकाश जी कोई सवाल?
Hello.
Yes.
Yes,
Dubai,
sir.
tell me.
Sir, good evening.
Good evening, beta. बोलो.
सर ये GV20 और एक्स्ट्रा पॉइंट 3 हम काम द माइंड के लिए सब में यूज करेंगे कॉमनली कि जो सेपरेट दिए वो ही करने हैं?
देखो बेटा, हर सिम्टम का अलग अलग इलाज होता है. Generally, this is my experience which I have written.
Okay.
मैंने तो मैंने देखा कि इन पेशेंटों में अगर ये पॉइंट्स अगर आप यूज करते हो इस तरह से, you get a very good result.
Okay. So, like it's for ADHD, GV20 and extra point 3 I use. And for bi syndrome, I use B45, BL20, and ST36 separately. But
See,
I
you
do
have to
not.
identify. See, now you have to see the TCM points which I have given you, right?
Right, sir.
You have to read the symptoms very nicely.
Okay.
Okay, Master.
Then you have to decide which point you have to use.
Okay.
Just don't memorize this and use in all the patients. I've just given you my experience, right?
Right.
But now you have to select the points as per the symptoms of the patient. Every patient has a different symptom. You cannot use this randomly on all the cases. Right?
Right. Yes.
So when you will treat the patients, you may use these points in the beginning. See the symptoms, follow the category in which they fall, then choose the principal points, and then use the supplement.
Then supplement.
Agbanshu, Agbanshu, any question?
No, sir. No, sir. No questions, sir. Thank you.
Pradeep? Pradeep, any question? Pradeep, any questions? Okay, then thank you so much. We'll meet
Thank you,
tomorrow.
sir.
Thank you so much.
Thank you.
No, sir. Yes, sir. Thank you, sir. Sir.